Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this audiocast, I would like to review for you the 5 themes or articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the April 2012 print journal, along with the accompanying editorials. This month's main theme addresses the clinical and educational consequences of resident physician duty hour restrictions. The original article, entitled Service Census Caps and Unit-Based Admissions, Resident Workload, Conference Attendance and Patient Safety, was authored by Dr. Uma Thanarajasingam and colleagues from Mayo Clinic in Rochester, Minnesota. Going from the fact that high resident workload has been associated with decreased participation in educational activities, increased medical errors, and higher patient mortality, the authors tested the effect of an intervention on residents' workload, conference attendance, and duty hours, all tracked electronically. That intervention included limiting the patient census to no more than 14 patients and moving to unit-based admissions. The authors also examined, as variables for patient safety, events requiring the rapid response team or cardiopulmonary resuscitation, intensive care unit transfers, and 30-day readmissions. They found that the residents' ratings of workload appropriateness improved, and so did their attendance at educational conferences. The number of duty hour violations by working too many hours consecutively or not having enough time between duty periods decreased. All patient safety measures remained unchanged except for 30-day readmissions, which decreased. A video interview with Dr. Thanarajasingam can be viewed on the homepage of Mayo Clinic Proceedings. The accompanying editorial, entitled Education and Patient Care Effects of Resident Workload Restrictions, Tackling a Largely Unexplored Subject, was authored by Dr. Ingrid Philibert, who is Senior Vice President for Field Activities of the staff of the Accreditation Council for Graduate Medical Education, or ACGME, which is based in Chicago, Illinois. The editorialist compliments the authors on their work and re-emphasizes that, as noted elsewhere, patient census and admissions are not optimal measurements of workloads, and that the few validated measures of workload were originally developed for reimbursement purposes, workforce planning, or to test replacing resident services with work by non-resident physician practitioners. The editorialist recommends further research into the development of better measures of resident workloads, exploring metrics that go beyond the volume and throughput measures that are currently used. Future measures should include work intensity, including the cognitive and emotional demands of resident work. As one such concept, she mentions cognitive saturation, which has been applied previously to examining aviation safety. A second theme in this month's issue of Mayo Clinic Proceedings addresses the balancing of melanoma risk and the treatment of low vitamin D levels. The original article, entitled Increasing Incidence of Melanoma Among Young Adults, an Epidemiological Study in Olmsted County, Minnesota, was authored by Dr. Curtis Reed and colleagues from Mayo Clinic in Rochester, Minnesota. The authors identified all patients aged 18 to 39 years who had a first lifetime diagnosis of melanoma between 1970 and 2009 from the Rochester Epidemiology Project data. They found that over the time period that they examined, the incidence of melanoma increased 8-fold among young women and 4-fold among young men. Overall and disease-specific survival seemed to improve over time. The authors conclude that close monitoring by skin cancer screening exams among young adults is necessary. A video interview with Dr. Reed can be viewed on the homepage of Mayo Clinic Proceedings. The special article, entitled A Dermatologist's Perspective on Vitamin D, was authored by Drs. Veena Vankeenathan and Henry Lim from Henry Ford Hospital in Detroit, Michigan. Vitamin D supplementation is a hot topic with much interest into which patients should receive supplementation. The authors discuss a dermatologic perspective on vitamin D in a question and answer format. They address methods of obtaining vitamin D, including cutaneous biosynthesis, diet and supplements, and review the recent U.S. Institute of Medicine recommendations. Further, the authors address the association between vitamin D levels and skin pigmentation, climates, and photoprotection. Specifically, they elaborate on sun exposure as a method of normalizing vitamin D levels in the context of the risks of solar and artificial radiation, including melanoma, which was the subject of the last article we just discussed. Finally, they identify groups at risk for vitamin D inadequacy and the role of phototherapy in certain patient groups. And there is more on vitamin D in Mayo Clinic Proceedings this month. 2 letters to the editor expand on the article Association between low serum hydroxyvitamin D and depression in a large sample of healthy adults, the Cooper Center longitudinal study, that was published in our November 2011 issue. One letter is entitled, Can Vitamin D Deficiency Break Your Heart? And the other, Predicting Recurrent Depression Using Vitamin D Levels. The original article entitled, High School Football and Risk of Neurodegeneration, a Community-Based Study, was authored by Dr. Rodolfo Savica and colleagues from Mayo Clinic in Rochester, Minnesota. Chronic traumatic encephalopathy, such as which occurs after multiple concussive head injuries, has been linked to progressive neurodegenerative disease later in life. To further examine this link, the authors identified all male students who played football between 1946 and 1956 at high schools in Rochester, Minnesota, and compared them to a control group of male students from the same time period who did not play football. The authors found no increased risk of dementia, Parkinson's disease, or amyotrophic lateral sclerosis among 438 football players compared to 140 non-football playing classmates. Compared to the expected incidence rates in the general population, the incidence of Parkinson's disease seemed increased, but this was true for both football players and non-football players. The authors conclude that having played football with poorer equipment and less regard for concussions compared to today was not associated with an increased risk of neurodegenerative disease over more than 50 years of follow-up. A video interview with Dr. Savica can be viewed on the homepage of Mayo Clinic Proceedings. The original article entitled Meta-Analysis of Randomized Control Trials of Vancomycin for the Treatment of Patients with Gram-Positive Infections, focus on the study design, was authored by Dr. Konstantinos Vardakas and colleagues from Henry Dunant Hospital in Athens, Greece, and from Tufts University School of Medicine in Boston, Massachusetts. Going from the premise that prior studies have emphasized some important disadvantages of vancomycin use and the fact that several antibiotics with similar spectra to that of vancomycin have become available, the authors included 53 trials comparing vancomycin with newer antibiotics in their meta-analysis. Their detailed findings can be summarized as showing equal effectiveness of vancomycin compared to newer antibiotics in most infectious diseases scenarios that the authors examined. Their detailed findings can be summarized as showing equal effectiveness of vancomycin compared to newer antibiotics in most infectious diseases scenarios that the authors examined. Vancomycin seemed to be less effective in the treatment of complicated skin and soft tissue infections in open-label trials, but not in blinded randomized trials. The authors conclude that the quality of each study should be taken into account before making treatment decisions, and that having alternative, equally effective antibiotics available will allow individualizing the antibiotic therapy based on drug effectiveness and safety for a given condition. The review article entitled Clinical Pharmacology, Uses and Adverse Reactions to Iodinated Contrast Agents, a primer for the non-radiologist, was authored by Drs. Jeffrey Pasternak and Eric Williamson from Mayo Clinic in Rochester, Minnesota. The authors note that physicians in almost all specialties will at one point either administer iodinated contrast agents or care for patients who have recently received them. The different iodinated contrast agents vary greatly in their chemical properties, uses, and toxic effects. To allow the non-radiologist physician to gain insight into this class of drugs, the authors discuss in detail their clinical pharmacology, administration, risks, and adverse effects. A video interview with Dr. Pasternak can be viewed on the homepage of Mayo Clinic Proceedings. Again, please be reminded that authors of 4 of the articles we have discussed, Drs. Thanarajasingam, Reed, Savica, and Pasternak, have provided video interviews. These interviews are available on the new homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the upper right-hand corner. We are aware that these videos can be slow to download and play, and we ask for your patience while we work hard on this problem. I'd also like to once more relate our plea that you share with us suggestions you might have for improving the quality of our print journal or website and of our services. On our homepage, you will also find additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board and I sincerely hope that you will enjoy these and other outstanding articles in the April 2012 issue of our journal. We do thank you for your interest in and continued loyalty to Mayo Clinic Proceedings, and we are grateful for your ongoing support of our journal's mission to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. The May 2012 issue of Mayo Clinic Proceedings will be published online on Wednesday, May 2, 2012. Please check back on that date to hear the audio summary of highlights from that issue. Until then, enjoy spring.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.